The thyroid gland is a structure in the front of the neck. It has the shape of a butterfly, with two lobes that look like the butterfly wings. There's a piece of tissue in the middle of the gland that connects the two lobes, and this is called the isthmus. The thyroid gland produces thyroid hormone. This hormone controls the body's metabolism. Too much thyroid hormone speeds the body's metabolism, and too little thyroid hormone slows it down. Thyroid cancer starts in the thyroid gland. A diagnosis of thyroid cancer can occur at any age and affects both men and women, but it more commonly affects women. The most common type of thyroid cancer is papillary thyroid cancer, which makes up more than 80% of thyroid cancers. Papillary thyroid cancers usually grow slowly and respond very well to treatment. However, between 10 to 20% will come back or recur after surgery. Doctors use the word prognosis to describe the likelihood that the cancer will come back or cause death. A good prognosis means that it is not likely to recur after treatment or to cause death. Papillary thyroid cancer usually has a good prognosis. Papillary thyroid cancer can begin as a single spot or nodule, but about half the time, there is more than one spot in the gland. Sometimes the nodules are larger, and other times they are so small that they can only be seen with a microscope. The number of separate nodules does not seem to affect the prognosis. If left untreated, papillary thyroid cancer can spread outside of the thyroid gland to the lymph nodes in the neck. It does not usually spread farther to distant areas of the body outside of the neck. A diagnosis of papillary thyroid cancer is made with a fine needle biopsy of a nodule. This is where a needle is inserted into the nodule and some cells are taken out. These cells are examined under a microscope to see if they are cancerous. If they are papillary thyroid cancer, your doctor will order more tests to find out how large the tumor is, whether the cancer is grown outside of the thyroid gland, and whether it is spread to the lymph nodes or other areas of the body. The doctor will also check your thyroid hormone levels and may even look at your vocal cords using a piece of equipment called a laryngoscope. Having all of this information up front helps the thyroid surgeon plan the type of surgery that is needed. This information also gives the doctor an idea of whether the cancer is aggressive or not. Aggressive cancers are cancers that grow more quickly and are more likely to recur after surgery. Knowing which cancers are more aggressive and which ones are less likely to recur is really important for making treatment decisions. This is where Thyroid Guide PX can play a big role. Thyroid Guide PX is a molecular test that can determine what subtype of papillary thyroid cancer you may have. It also identifies how aggressive the cancer is. By using Thyroid Guide PX, you and your doctor will have more information about the type of papillary thyroid cancer you have. This in turn means better, more personalized treatment decisions and follow-up care for you.